Hello, everyone, and welcome to today's Funding Opportunity webinar. We'll be talking about the opportunity for addressing substance use disorders in America's jails, clinical guidelines for withdrawal management. With that, I am going to turn it over to Rachel Brichette from the Bureau of Justice Assistance. Rachel is going to welcome us and kick us off today. Rachel, can I get a quick sound check from you?
Yep, I'm here, Kristen, I hope.
Yes, you sound great, Rachel. Take it away.
Wonderful. Thank you so much, Kristen. And my apologies to those of you on the line for not being on video today. Unfortunately, technology has decided it is not my friend and my webcam is not working. But please know that we're very glad to have you joining us on this webinar today. As Kristen said, my name is Rachel Brichette and I'm a Senior Policy Advisor at the Bureau of Justice Assistance. I manage several project portfolios, including the comprehensive opioid, stimulant, and substance abuse program work that focuses on jails and community corrections. And that would be the acronym COSAP that you're going to hear throughout the course of the presentation today. Also joining me on the webinar today are two staff from AHP. They are the training and technical assistance provider for the COSAP jails and community corrections work, Pam Rayner and Deanne Jepson. I'll let them each introduce themselves as they start their sections. A quick review of the objectives of this afternoon's webinar. At the conclusion of this webinar, we would hope for you to be able to have a solid understanding about the purpose and the deliverables of the funding opportunity, to be able to determine if your organization is an eligible applicant, and to be able to locate the application materials and instructions, as well as where and how to ask questions as they arise. Before getting into the meat of the RFA, I wanted to provide some context on how BJA and NIC got here. I'm sure this is not new to most of you on the line, but I think it's a useful contextual reminder. So we all know that the opioid epidemic has thrust jails into a new role. In many communities, jails now serve as the largest substance use treatment provider. Withdrawal from opiates, alcohol, and other substances brings increased risks, and non-medically supervised withdrawal can be life-threatening. These risks are often magnified in a jail setting, as jails are not necessarily designed to be medical facilities, even though they're increasingly being called upon to serve in that function. The number of deaths in jails due to severe withdrawal symptoms has increased, as have the number of deaths from drug and alcohol intoxication. We know that this is a problem that's not going away, so the lack of adequate withdrawal management protocols puts jails and jail staff at increased risk of liability. Based on all of this, as well as conversations with the field and feedback over the last several years, BJA, in partnership with NIC, or the National Institute of Corrections, wants to address this issue by developing evidence-based clinical guidelines and protocols that will help jail administrators, correctional officers, and jail-based clinicians identify and safely manage substance use withdrawal in a jail-based setting. And this RFA is one component of this work. The purpose of this RFA is to develop clinical guidelines and protocols, essentially what we want to think of as a toolkit. And that's going to be something that key stakeholders can take and use and apply to identify and safely manage withdrawal in a jail-based setting. While we know that this alone isn't necessarily going to solve all of the issues faced by jails around the country, we do know that this is an important step to helping jail administrators and other key stakeholders improve outcomes. I'm now going to pass the presentation along to Pam to talk more specifically about the contents of the RFA. Pam?
Let me just pull up my, so good afternoon, everyone, and depending where you are in the world today, good morning or good evening. And thank you again, Rachel. You always do such a great job of setting the stage, and I really appreciate you providing the background and the purpose for today's webinar announcement of the RFA for developing clinical guidelines for withdrawal management to help jails across the country addressing substance use disorders. My name is Pam Rayner, and I'm the project director for BJA's COSAP program. As one of 7 COSAP training and technical assistance providers, our focus is on jail treatment services. And through that, we have worked in close collaboration with BJA and the National Institute of Corrections, also known as NIC, to develop this RFA. and it really is our pleasure to meet with you today. I understand we have many people on the line. I'm sure everyone joining us has read the RFA, and we welcome you all to this webinar intended to help clarify the purpose and deliverables, the eligibility criteria, and how to apply as you determine your next steps. You may post questions, as Kristen said, in the question box, and we will answer any of the questions that we can today. All of the questions will be included in an FAQ document, which will be posted within a few days, and it will be mailed to all webinar registrants along with a recording link to the webinar. So you will be well informed today, and if any of your colleagues could not make it, they'll have access to it. And so now I'm going to move us into our guidelines. Okay, good. We're matched up. The guidelines for this funding opportunity are described on page 2 of the RFA, so I'll briefly note them here for your reference. The guidelines to be developed need to address rapid withdrawal from rapid withdrawal from all substances individually and in combination, recognizing the increasingly urgent issue of polysubstance use across the country, and to help correctional personnel understand how withdrawal symptoms are manifested. We are aware of the concern regarding the term withdrawal management and how it can be interpreted by some as a replacement for treatment, and we want to assure you that this publication is meant to recognize the acute withdrawal symptoms that can lead to death, and as we all know, the increased risk of suicide due to acute withdrawal. So as I noted, the second bullet there is asking that the guidelines also address screening for suicide risk and medication maintenance for entering detainees. We've also included transition to buprenorphine maintenance or detoxification when the detainee prefers, especially for facilities that do not have access to methadone maintenance. The guidelines will also include standards for dosage and administration of agonist medication following withdrawal management. And to complete the cycle, we've included protocols for prescriptions upon release from custody, transition to treatment in the community, along with record sharing with community providers. And next slide, please. The guidelines and protocols need to be informed by best and evidence-based practice while recognizing the need for correctional facilities to prevent diversion. In addition, BJA, NIC, and AHP, which I'm going to refer to as the oversight team because I'm going to use the three of us in combination several times. We are currently working with Georgetown University on a toolkit that describes the standards and implementation strategies for managing liability and negative outcomes in developing a comprehensive withdrawal management protocol. The clinical protocols developed through this RFA will be informed by this legal analysis, so the synergy of the two products will fully inform correctional facilities on both the reasons why the guidelines are essential and how to help prevent deaths through evidence-based guidelines and protocols. And next slide, please. Thank you. So I'll move us into the major activities and then break down some of the tasks. To produce a comprehensive set of clinical guidelines for withdrawal management, the process needs to be guided by a planful process, which includes an advisory committee of expert panels, experts in the field with direct relevance and current knowledge about medical withdrawal management and an understanding of the issues that correctional facilities need to navigate to train staff on symptoms of withdrawal and evidence-based medical approaches to dosing and effective medications. The awardee will develop a detailed outline, content outline based on an environmental scan of existing guidelines for withdrawal management to be shared with the expert committee, and then incorporate findings from the scan and the expert committee feedback and present that plan to the oversight team. So as you can see, it's going to be a very collaborative effort. The fourth activity noted is to produce a draft for review and then a final set of guidelines and protocols. And next slide, please. So the major activities are broken down into the 6 tasks outlined on pages 3 and 4 of the RFA and also represented on the slide. So we'll go through each of these. So next slide, please. So we're looking for a single project director to manage and oversee the work and budget in an efficient and effective manner that includes regular communication with the oversight team. We're looking for within 10 days of the start date, the project director and key staff to attend a kickoff meeting with the oversight team to review a work plan of the goals and tasks, including project timeline, staffing plan, and budget. And then within 20 days of the kickoff meeting, the project director will present a work plan covering, again, staffing, budget, and the proposed methodology for consensus building and completion of tasks. And then the project director and key staff will meet with the oversight team monthly to review activities, status update, adherence to the timeline, any challenges and solutions, anything that they're looking for feedback on, and brief detail of expenditure of funds. We're looking for minutes from the meeting, hopefully submitted within 5 days following each call, and then a monthly report of activities will be submitted to the AHP project director, and that's me. Next slide, please. On to task 2 and 3. We'd like the awardee to identify and convene the expert advisory committee to guide the development of the publication, along with input from the oversight team. And we wanted to note that honorariums are available to eligible members. Task 3 is to complete and submit an environmental scan of existing guidelines that address withdrawal management from opioids, benzodiazepines, alcohol, methamphetamine, and cocaine. And we would like to include special populations such as pregnant women and people with mental illness and comorbid physical health disorders. And next slide, please. And to task 4 and 5, thank you. So task 4 is to develop the content outline for the publication based, again, on the environmental scan, the advisory committee input, and then to revise the outline based on those discussions with the BJA, NIC, and AHP team. So again, we're working very closely all through the process. And task 5 is to develop a draft guideline for the target audience following the BJA style guidance for written publication. And then finally to complete a final 508 compliant version and present the publication at a briefing to be held. At this point, we're planning on or hoping really that the briefing can be held at BJA, and if travel is still prohibited, that will be held virtually. And next slide, please. Thank you. And to close out the project, as noted on page 5 of the RFA, all materials belong to the United States Department of Justice, also known as DOJ, and DOJ retains all rights to the deliverable. All materials not previously submitted will be submitted to AHP and maintained as property by the Department of Justice. And next slide, please. Thank you. So objective and performance period. We understand this is a tight time frame, so let me just go through that a little bit. So one applicant will be selected for a 10-month award, and we are hoping that that will begin November 23rd of this year and end September 30th of 2021. So AHP will create one subcontract directly with the awardee, which means no registration with grants.gov is required. And subject to BJA approval, it is possible the period of performance could be extended, but the expectation at this time is that the project will be completed by the end of the fiscal year. And again, there's one awardee, but you can also bring in partners. Next slide, please. Yep, thank you, eligibility. So organizations, including but not limited to nonprofits and universities, committed to improving the standard of care in correctional facilities and can demonstrate a history of setting clinical standards around medication-assisted treatment and developing operational protocols within a correctional facility, or again, willing to partner, are eligible to apply. And I apologize for reading that one, but I felt it was really important to make sure we got all of that in there. So applicants need to demonstrate a deep understanding of correctional health care, addiction medicine, jail administration, and extensive experience with medical standards and protocol development. This also includes organizational capacity and project management to complete the goals of the project, including the ability to convene that interdisciplinary team of key stakeholders all the way through completion of a 508 compliant publication. And please note, and it does state in the RFA, that current COSAP grantees, their subcontractors, and consultants are ineligible to apply for this. And next slide, please. Up to $298,500 will be awarded to one entity. The awardee may be a single entity or again choose to partner based on organizational expertise and or capacity. The award will be a fixed amount based on the recipient's approved budget. And the award notification is expected to occur on November 9th of this year, pending BJA approval, of course. And next slide, please. Thank you. So we're going to go into the budget a little bit. Awarded funds include personnel costs, subcontracts, consultants, honorariums, and then other direct expenses such as graphic design or virtual meetings and indirect expenses. The budgets must be complete, cost-effective, and consist of allowable expenses, and you will find these same allowable costs outlined on page 5 of the RFA. And next slide, please. So you can download and complete the budget detail worksheet. Please note that that is a separate document from the RFA, and the instructions for the budget are located on tab 2 of that spreadsheet. And you can see right there are the instructions, and again, that's tab 2. And next slide, please. Thank you. So the complete budget is the second tab on the spreadsheet, and all applications really need to conform to this template for consideration. The budgets will be reviewed for cost reasonableness, of the final fixed price amount awarded, and you need to show the cost of each task and subtask. And so with that, I thank you for your time and your interest in applying for this RFA. We look forward to your questions. And I will now turn the presentation over to Deanne Jepson, our COSAP Deputy Director for Product Development, who will go through the steps for applying. And Deanne, you may now begin.
Thanks, Pam. I appreciate it. And again, my name is Deanne Jepson, and I am a Senior Program Manager at AHP, and as Pam mentioned, a Deputy Director on our COSAP team focusing on product development. So let me change the slide here. So I just wanted to go through how to apply. If you haven't done so already, all of the RFA documents, and when I say RFA documents, I mean the solicitation, the actual application, and the budget detail worksheet are all on the COSAP website, and that is the direct link to the page that you see on your screen. Also posted there will be the recording of the informational webinar, and we will also post the frequently asked questions document that both Pam and Kristen talked about. So the first thing is, please download and complete the application, and then also the budget worksheet. And then in preparation for submission of your application, we would also like you to collect in one document and make it a PDF in your proposed project director's resume, brief bios of proposed key staff members and expert committee members, and then an organizational chart. And so when you submit, if you decide to submit, it'll be 3 documents. It'll be your application, your budget, and the PDF. So just to give you a little quick rundown, for the this is part of the application. You'll be asked to talk about your organizational overview and a general description of your capacity to respond to the current need of the guidelines and the target audience needs. This, as you can see, when we score it, not me personally, but our team, is up to 10 points, and there is a word limit. I do want you to know that we're not concerned about formatting. It just fits right into that application. You can use bullets if you need to. There is also a section talking about the statement of work. So we're asking you to provide a proposed statement of work and timeline of how this would work for you, and then propose a methodology of how are you going to recruit your expert committee members and get a consensus on the guidelines and protocols themselves. And then that is on page 3 of the RFA application. There's also a section talking about your project staffing and capabilities. There is also a section to talk about your budget. So this is where you can stick your project budget narrative, explaining what is on your budget detail worksheet. So that is the part that will justify what you've put into the budget itself. And you can find that information on page 5 of the RFA. So again, there's not a lot of sections in terms of areas that you need to cover. So hopefully it'll be pretty straightforward for you in terms of filling out the application. Again, you can refer to the frequently asked questions. You can submit, if you have additional questions after you get off of this webinar, you can send them directly to me, and I will make sure that they get answered. I need all of your questions submitted to me by tomorrow. And submit, the biggest deadline is to submit the completed application, the budget detail worksheet, and the PDF not to me, but to the email that is provided here, withdrawal management, RFA@AHP.com. And there is an underscore between management and RFA. All applications need to be submitted by 5 p.m. on October 28th, 5 p.m. Eastern Time. And just to remind you of the important dates, of course, today is the informational webinar. Please submit any additional questions to me, although a lot of your questions may get answered by the document that we're putting together, the application deadline, which is October 28th. Anticipated selection date, we hope it'll be at the beginning of November, around the 9th. And then, as Pam mentioned, the anticipated start date is November 23rd for the project. So I'd like to go ahead and ask Kristen to come back on and close us out.
Great. Thanks, Deanne. I'm going to join you back on camera here. So, folks, I do see that you are submitting questions into the question box. Please continue to do that. We're going to leave the room open to accept your questions for a few more minutes because we did schedule the webinar to last long enough to gather those. However, I do want to remind you that you have until tomorrow to submit questions in writing to Deanne, and I will put that email address and that deadline into the questions box. So with that, we're going to conclude the presentation. You may disconnect when you're ready. However, again, we will leave the room